What would I chart about? All right.
Do you want to like?
So this is impaired skin integrity or risk for infection. I really don't care which one you pick, and so on.
I mean, can we say it's related to surgery just because, or should we?
Well, you could say related to surgical incision if you want, but I still think that's related to surgical incision. This one's going to be related to trauma. Okay, and the patient has this wound that's about a, about a 5-centimeter wound on their left thigh. And my intervention was I removed the soil dressing. There was no odor, no drainage. It wasn't beefy red all the way around there or anything that would lead me to think it was infected. So, but don't say something I would prefer in your career, the best defense for you if you have to go up and see your charting on a 24-foot screen in front of a jury of your peers is to not say vague things like no signs and symptoms of infection. I think it's really handy if you actually write no redness, no swelling, no this, no that. That's what I saw at the time. Because trying to remember it a few years later is different. Okay, and then I'm going to say I cleansed the wound with normal saline. I reapplied wet to dry, and I usually say using sterile technique. And the patient tolerated the procedure well. And now my evaluation or my response of this is going to be,
Continue monitoring.
We'll continue to monitor wound healing, all right? And so that's it, all right? And when I write Jane Hunt, all right, okay, put my head down.
I'm sorry, when there's an eschar present, does that mean it's
Eschar?
already been infected?
For sure.
Eschar is just dead tissue. It's just a layer of dead tissue. It's like an especially thick scab in a
So it's not really...
because a scab is really on the epidermal layer. It's not okay, but eschar is deeper. All right, need that.
When we're on like signing date and stuff, do we do that with the sterile gloves on and just pick up a pen and write on tape?
You can do, yeah, you can do. At that point, I guess it would depend on how. That's what I want you to practice and try and do. But wait a minute, what if you're here and you're taking the assessment and you go like this, you go like that, you go like that, you pull up your sleeves, and you're thinking, oh, she didn't see that. Okay, I saw it, all right. And I don't care, yeah. Yeah, you're just going to say, you know, I contaminated that, so I would remove these gloves, and I would have my secondary set, and I'd go with it. Because it doesn't matter about making that level of error. It matters that you're protecting yourself, and so on. That's what I care about.
Should we be like in our last vote?
You know what, I think it'll help you to feel better about doing it, because we're taking this to the hospital. In 3 months, we're going to do dressing changes. We're going to walk up and say, hi, do that dressing change, and that's why we're just making you go through the steps here. In the fall, we're going to have a skills day, and we come back, because it'll be so hard to remember everything.
Yeah.
So I'll have a wound and a this and a that and the other, and I'll let you come through in pairs and do everything to feel safe and effective. That's my goal. All right.
So when you're like changing the dressing, would you need to give them pain medication anyways? Because like when you're taking it off, what is
Yeah, probably they are going to need pain medicine is my guess on this, particularly in a wet to dry. And then, but we're not doing pharma in this course, so I'm not going to complicate it, because then you have to know how soon it takes effect and all that kind of stuff. But I just want you to think of it and ask. And you can pretend yes or pretend no. And if you want to pretend yes, say, okay, I'll get you some pain medicine. And you can say, oh, I'm getting you pain medicine. Do it like that. All right? Because that's what you would do. All right, let's get the stuff. The next one, you could do that. Do that. You're using a different one each time. Do that and do that. But I just think rubbing a wound is not, you know, you're not going to make as many friends.
You stick it in there, right? You stick it in there.
Yep, just like that. I want the wetness in the wound.
And the dryness outside.
Better.
There you go. And so you're doing this. And you're doing this.
For the one with granulation, that's okay to do?
No,
She said just pretend there's no
We're going to do this for the purpose of knowing wet to dry. Okay. All right.
She looks dead.
Patrick, you're terrible.
Okay, is that all right?
She'll
Okay,
open her
that
eyes.
leg looks disarticulated here.
Yeah, no,
Okay, do you have a wound over there?
There's one.
Do you have